Florida's Education Department has finally released student results from its brand new mental health survey intended for teenagers. That survey replaced a federal survey that Florida's education boss called too sexualized. But tonight, as investigative journalist Katie LaGrone shows us, these new rules, these new results have child advocates concerned.
Florida teens are resilient but continue to struggle mentally and emotionally. Those are the broad but vague conclusions from Florida's newly created health survey for teens. Some tout it as a good start.
I think overall the state can look at these results and give themselves a little pat on the back.
Others are critical, calling the state results too general.
We're really struggling to find meaningful conclusions from what we've been presented.
The survey, which went out to an unknown but limited number of high schools last spring, replaces the CDC's Youth Risk Behavior Survey, long used by states to chart and compare risky behavior among U.S. teens. But after Florida's education commissioner called the federal survey inflammatory and sexualized, the state created its own. We obtained a copy last year revealing its focus on resiliency standards, including grit, gratitude, perseverance, and citizenship, versus actual youth behavior like sex, hard drug use, and gun violence. According to the recently published results, which were inexplicably delayed for 6 months, Florida teens scored high in overall resiliency, with breakdowns for student gender and ethnicity. But similar demos aren't included in student behavior results. For example, 9% of the nearly 3,000 high schoolers who voluntarily filled out the survey said they've been victim to dating violence. 26% of students said they've had sex. And nearly half of those who expressed some level of anxiety during the school year reported feelings of sadness, hopelessness, or loneliness. But
we don't know who was surveyed. We don't know, was this a cross-section of the state or one community?
Takeda King Pang works with the Women's Foundation of Florida and Florida Healthy Youth Alliance. Both groups have historically used results from the federal study to determine needs and resources for Florida teens. She's concerned results from the new state survey lack too many details to be useful.
It does feel that they want to present their best face forward, right? That seems natural. You want to show that your young people are doing well. I just think we're doing the youth across our state a disservice by not looking at this in a factual and scientific manner of, what is happening.
Even those who support the state's new resiliency direction question who and what the state is leaving out.
The results are great, but they're not as accurate as they can be because they don't represent everyone.
Christy DeVigili is a mom and parents' rights advocate who helped create the state's new resiliency standards for this new teen survey.
I think Florida's on the right track in putting their focus in the right areas, focusing on resiliency rather than focusing on the problem as much. But I definitely don't think we should be ignoring the problem.
We've submitted public records requests in hopes of answering a lot of these questions. Once we get that information, we'll share it with all of you. I'm my team investigator Katie LaGrone, taking action for you.